Good afternoon, Ali.
Good afternoon, Perla.
Thank you very much for taking the time to speak to us today about your experience with Luspatercept.
My pleasure. It's just something that I have to do to explain to people all the benefits of this drug.
Excellent, thank you. So you were born in 1961 in Cyprus in a village called Polemidia near Limassol.
Correct.
And you moved to the UK when you were 12. And you were diagnosed with thalassemia around the age of 1 when you needed to have your spleen removed.
Correct.
Because it was growing very big. And at the time, straight after your splenectomy, you started transfusions.
Correct.
Initially irregularly, then they became more regularly, and since then you have been on regular blood transfusions throughout your life up until this very moment.
Correct.
Excellent. So, do you want to tell us when you started taking part in the clinical trial looking at the Luspatercept?
Clinical trial was actually offered to me if I wanted to go on it about 5 years ago, and I've been on it on the trial for about 5 years. At the beginning, I was actually on the placebo for about 20 doses of the trial, but nobody knew that I was actually on the placebo because it was blindfold. About after 20 doses, it was unblinded, and they looked at it and they were baffled because I was actually not giving results, like my hemoglobin was not dropping like normal. So they had to relook at my genotype. And when they done the genome trace, they think that I was actually mild, moderate thalassemia patient. And they looked at it, and then they put me on the Luspatercept that I'm on now. And I've been on it for nearly 4 years, which is actually giving me benefits basically, because I have gained from the drug about 50% gain. I was having my transfusions approximately 3 to 4 weeks right at the beginning before I went into the trial. Now I go around about 6 weeks without transfusions, which is actually beneficial due to chelation and less blood transfusions basically. The effects are beneficial because it's actually it hasn't changed my sequence of treatment. It hasn't actually given me disadvantage or hold me back from doing things that I was doing. It just, we adapted it in a way that is actually beneficial and is showing results and is making me go longer, not having transfusions.
Yes. So can you tell us what is the hemoglobin range now before your transfusion?
My trough has actually been arranged, and they looked at my trough to see what I was doing. Now, when I get to 10.6, I can have 3 units of blood if I'm anything between 10.6 or anything lower, or if I'm over 10.6, then I can have 2 units. And if I'm over up to nearly 11, I can have only 1 unit. So I'm not really going without having blood transfusions.
Yes.
I'm just regulating it in a way that is actually safe to the protocol of the guidance and the protocol of the trial. You just have to follow what the rule is. And the only side kick about the trial is that you probably need to have a little bit more blood tests.
Yes, yes.
And you're being monitored a little bit more.
Right. So would you say your transfusion requirements dropped by half since you have been on the actual Luspatercept drug when we switched you from the placebo to the actual drug, or how would you quantify?
Since I've been on the Luspatercept, my beneficial gain is around about 50%.
Right. Okay.
So basically, I'm going around about 6 weeks instead of 3. and a half to 4 weeks.
Yes, yes. And how many units do you have?
And I normally try to cycle the transfusions till I get to the trough of 10.6 or lower, so that I can have 3 units.
Yes.
If I have to travel or do anything in the sense or whatever, I regulate it, so there's a little bit of flexibility. So you can have maybe 2 units or 1 unit, whatever, you know, this depending on your hemoglobin.
Yes. And have you had any problems being on the Luspatercept? Any side effects from it?
Luspatercept is not actually the main issue of giving you side effects. Basically, everything is to do with your trough. If your hemoglobin is on the low side, you feel the fatigue like normal. You feel, the bone problems. You have the back problem where you get the throbbing and the knees.
Yes.
But also, you got to bear in mind that you also, have issues like osteoporosis.
Yes.
And
degenerative
and other issues
which
relates to thalassemia,
yes.
and that will also
yes.
look into make problems in the sense of. But the Luspatercept is not does not give you any issues.
Would you say that any of those pains became worse at any point in time when you started Luspatercept? Because some patients describe that sometimes.
The pain, you got to balance it, and you got to look at it. What you was actually when you was not having Luspatercept, and when you are on Luspatercept, and you got to have some sort of a feel that you have a sense of whatever was going on with your body. So every patient could be different.
What is your experience?
From my experience, it's mild effects.
Okay.
But you got the pain of in the knee where you got a bit of arthritis.
But in relation to the Luspatercept, have you noticed any of those pains that you experienced even before you started the Luspatercept becoming worse?
When I was not on the Luspatercept, I was not getting any of these pains because basically it's 5 years ago. 5 years ago I was more younger.
Yes. Okay.
So
it's difficult to know. Really.
So basically, you know your body.
Yeah.
Everybody knows their body, and they know their what they can they can do and they can't do. And if you push your body to the limits, obviously that's going to give you problems. But it might. It's not the Luspatercept, I think, as a major cause.
And tell us, just for the patients who and healthcare professionals who don't know about how Luspatercept is administered and how often have you had it and how is it given to you?
Luspatercept is actually administered onto you is by injection, and it's very, very small, minute syringe where it's given into the soft tissue behind your armpit.
Under the skin.
Or it could be any other site which is actually they're able to do.
Yes. And how often?
And then you get the dosing done by when it comes to a situation where your hemoglobin is around about 11.
Yeah, but it's every 3 weeks.
Yeah, the cycle is about 3 weeks for the clinical appointments.
Yes.
But that doesn't mean that you will be getting the dose because your trough depends on.
Correct.
And your also transfusion influence could be also in the questioning.
Yes, yes. So there are a lot of factors affecting.
But your healthcare professional that administers the drug does monitor you very tightly, so it's very safe and it's very, very beneficial. And I think it's a good drug that is out on the market, and it should be funded in all means so that patients can get benefit of it.
Yes, I was going to ask you this now. I was going to ask how do you see the future of this drug, and what is your message to the rest of the patients, as well as the doctors and nurses, the healthcare professionals looking after thalassemia patients?
Well, the benefits of the drug, I see it as a further in-step development of bettering treatment. And I think in overall, there's a lot of hard work going into it by the research side of the trust that is, they're doing tremendous work. And I think in the long run, if it's funded, it will be beneficial for all, and it should be funded.
Okay. Thank you very much, Ali, for sharing your experience.
It's my pleasure. It's a pleasure to do this interview.
Thank you
very much
much
for all of your help.